Yeah. Oh.
Freebie.
Funny.
Why, thank you.
I'm not sure if it hurts or feels good.
That's literally the motto of my clinic. I don't know if it hurts or if it feels good, but we're going to do it.
That's right. I like it. I don't know why I waited to come back so long. It could have got fixed sooner.
We just met, but I guess I'll say I missed you too, maybe? Yeah, that doesn't really make sense, but that's what I say when
Now
my
I know
patients say,
better.
I don't know why I haven't come in months. It's
That's
like, you
right.
can just tell me you miss me. It's fine. Patty.
Yes.
Good to meet you today.
Nice to
Thanks for
meet you.
coming in.
Absolutely.
Patty is a new patient who runs a cleaning business, but she's in today with some kind of was that your right
It's my
shoulder?
right shoulder.
Right shoulder, maybe neck, upper back complaints. I'm going to let her talk about them. So Patty, why don't you kind of walk us through what you're dealing with?
Okay, so I typically, during the day, I'm right-handed, so I'm cleaning, so that involves a lot of moving the shoulder, okay, that whether it's pushing and pulling or it's this kind of motion. And I have had a history with this shoulder, always, overworking it in various capacities. Because I used to have a landscaping business too.
Oh, okay, so like hard labor for most of the life.
You
Okay,
got it.
yeah.
So it tends to what happened. It aches up here, and then it comes down into my hand when it makes numbness when I'm trying to sleep, and I'm a side sleeper, so. That's
and I
more
take it you
problematic.
probably sleep on that right side.
I do,
then?
and it's all curled up. I know it's really not favorable, but I can't do it any other way.
The most important thing about sleep is that it's restful, okay? Like, obviously, the best way to sleep is probably on your back, but that's not true if you can't sleep comfortably in that position.
Yeah.
So, obviously, numbness isn't ideal.
No.
If you're sleeping like this, you could be tensioning a nerve somewhere along the line, leading to that numbness. Seems pretty benign. My question to you is, do you get that, do you get that numbness or that kind of soreness during the day when you're not sleeping?
No, it's a
Okay.
sleeping thing, and so I have braces. So sometimes if it's really bad, or I know that I've worked a lot doing that, then I will deliberately wear the braces to bed, and that seems to correct the issue.
Okay.
So it's like a carpal tunnel thing, which I don't know if this is related, but it all kind of just it aches, and
Now,
it aches in the inside.
If I can ask, just because you said the term carpal tunnel there, the numbness in the hands, you have described it as numbness.
Yep,
Yes.
it's numbness.
Where do you feel that in
Tingling.
certain
like
fingers?
I can't even feel it. Can't feel my hands at all. Like,
Both hands or just the right
it
one?
happens in both left
Both
and
hands.
right.
Both
This
left
is
and
most
right.
prevalent.
As you're asleep only?
It can happen to me early morning too if I'm holding the phone, but it's a morning thing. It doesn't happen to me later in the afternoon.
Okay.
And then I know, okay, you can't do that, Patty. You have to like change your position because it will come. And sometimes it takes a good 45 minutes for it to leave. And I'm scratching my hand because a lot of times for
You're
me to
just
get
trying
it,
to bring it
I
back.
have to
Yeah.
give some texture or something, a towel.
Now, in that hand, are there specific fingers that you're getting numbness on? Like your ring and your pinky? Or
No,
like your
it's
middle,
like
index, and thumb? Or
It's pretty much the whole hand.
pretty much the whole hand
the whole
that you're
hand
feeling
is
that
just
in?
numb.
Okay,
Yeah.
interesting.
Yeah.
Usually with carpal tunnel, we're dealing with numbness of just the first 3 digits and occasionally the inside of the fourth. And that just has to do with the median nerve distribution. That's the nerve that's affected in carpal tunnel cases.
And maybe I'm recalling it, at the time I can't think. Next time it happens, I'm going to be like, which fingers?
You're going to make... you wouldn't think this as a non-doc or non-healthcare person, but yes, taking a mental note next time it happens to you, let me know.
I think that you're right, that it's more of these 3 and not these 2, but I have to think about it.
Well, next time, now you know, right? And then you can bring that info back. All right, but that's predominantly the right. You get it sometimes in the left. And it's either when you're sleeping on it or if you're holding your phone perhaps in a curled wrist position like that.
Because I sleep like that. I said, that's why the braces help, because they prevent me from curling my wrists like that.
That'll absolutely do it, right? The carpal tunnel, it's a little structure right there on the wrist. If you're like this all night, I would probably be numbing the hand too, right? So I would hesitate to just say, oh, it's carpal tunnel and throw a diagnosis on that. I don't think it's carpal tunnel. I think you're literally just compressing your carpal tunnel.
Yeah, I think so too, Because, and I'll wake up and I'll say, oh my Lord, Patty, you can't sleep like that. But then that becomes that, when you say, well, the best sleep is restful sleep, then it's not restful, because it's like, almost feels like this perpetual flip-flop of, okay, this hand's going down, okay, flip to the other side, okay, that's not comfortable. And I broke my ribs a couple years ago. I broke 3 ribs straight on this side, and I found that's the same thing. Today,
Rotating
last
would
night,
be
it was
very
like, it
difficult.
hurts, and I was like, okay, maybe that's again from overworking it. Yesterday, just
Entirely possible.
Yeah.
Right? Entirely possible. Again, restful is the most important,
Yeah.
but with that comes a balancing act.
Yeah.
Now with that shoulder, let's back it back up to the shoulder here.
Okay.
A lot of this kind of movements. Do you get the shoulder, the neck, and the upper back? They're all very connected biomechanically. Do you get neck tension and upper back tension with that?
I did yesterday. Like,
Okay, yeah.
So I'm pretty stressed these days.
Okay.
So I think that's also playing
Contributing,
into like
absolutely.
just and I carry it in here. So yeah, I would say like when I'm cognizant of it, I'm like, okay, now you're tight, Patty.
Yeah.
Okay. So in terms of back. Lower back hurts a lot, but I always know that that's because my core's not good.
Okay.
Okay. So I'm like, all right, that's really all I can say.
That is a potential common cause of back pain is lack of core stability. The core is the thing that functions as a rib cage for our lower back. It needs to have some degree of stiffness in order to avoid instability specific complaints. Now, if you do have an instability complaint, which I don't know yet, and maybe you've never heard of this kind of stuff before, yes, core strength would help that. But if it's not an instability complaint, it might actually be something else entirely.
Okay.
But lack of core stiffness or lack of core strength is a common source of pain for some individuals. In fact, I made a whole other video about it. Y'all can check it up in the corner. I'll get the editor to link it now. Okay, so low back pain, shoulder. Your neck was tight yesterday, so we can check that out too. Any other complaints, or do you think that's kind of the focus for today?
Yeah, that's really that's my focus.
Oh, if that's your focus, then
those are
that's
the
my focus
reoccurring
too.
problems. So it's like, okay, that's and this is my job. It's not going to change. So
Exactly. It's one thing to say like, hey, you should lay off those things, but if it's how you're making a living, an income, it's not much easier said than done, right?
True story.
All right. So what we're going to do today is we're going to get into a physical exam, try to figure out what structures may have been affected in the shoulder and everywhere else as well, and then figure out a treatment plan for you. Okay.
Sounds good.
Awesome. Patty's got complaints pretty much throughout the entirety of most of her back, especially yesterday. She was dealing with neck discomfort and has had that low back going on for a while now. We're going to start off just with the neck range of motion. I'm going to get you to bring your chin down to your chest for me there. Does that provoke any of the stiffness you were dealing with yesterday?
It feels a little tense there.
Feels a little tense there?
Yeah.
Okay, I'm going to go ahead and do something a little bit mean. I'm going to push your head further. Oh, worse?
Yeah.
Okay, come back up. Look towards the ceiling, please. Does that provoke anything back there?
No.
No? Awesome. I'm going to get you to rotate your head as far as you can to the right. Check your blind spot. We can get to about, I'd call that 60 degrees as far as you can to the left now, please. I call that also 60 degrees. We look pretty symmetrical. Right ear to right shoulder, please.
Hurts.
That's uncomfortable.
Yeah.
Okay, left to left.
Same.
You can get further to the left than you can the right, though. Okay. With the shoulder, you need to bring your arm up. Give me a thumbs up like that. Keep it right there. Don't let me move it, okay?
Okay.
Does that provoke any kind of pain or discomfort in the shoulder here?
No.
Give me a thumbs down.
Yeah, that's worse.
That's worse,
Yeah.
okay? I'm going to get you to actually bring this arm down.
Okay.
Down, up. Rotate in, and we're going to bring up like that.
No.
No.
No. Wait, when you're getting higher, then
Higher,
it starts
yeah.
to be a little bit.
Okay, bend the elbow. And rotate in.
Yeah, that
That's
hurts.
okay.
Yeah.
There we go. Going to get you to bring this arm, bend the elbow once again. Fight me, fight me, fight me. That's okay?
Yeah, not a lot of discomfort.
Not a
there.
lot. Fight me,
Okay.
fight me, fight me. Other way. That's okay?
A little bit,
Little
but
bit.
not. Yeah, it's low compared to the other ones.
Compared to the other ones.
Yeah.
Okay, last, put your hand behind your back for me, please. And try to lift off to touch the wall back here. That's okay, yeah?
Yeah.
All right. So
So it's just a little, like, just a little in here, but I mean.
right in there. Yeah. All right.
Okay.
So pretty standard. We got some pain on our empty can test, our NIRS test, and our Hawkins-Kennedy test. You guys can look those all up if you like. But all of those suggest we're dealing with a little bit of impingement syndrome or supraspinatus tendinopathy. Pretty standard for anybody who's doing a lot of repetitive shoulder movements. Okay, I see it at least 5 times a month. Very, very common and something that we can help with some base rehab and treatment. Okay, so don't be too concerned about that. There are things that we can do.
Perfect.
I'll get you to give yourself a tight, tight hug. I'm sure you've earned it. And then we get you to rotate as far as you can to the left for me.
This is because it's
This is the
where my
ribs we're
ribs.
talking about.
Yeah.
Was that the right or the left ribs?
So they're right here.
They're right here. And how long ago was that? 3 years?
No, it was just a year and a half ago.
Year and a half ago.
Yeah.
Okay, so those would be fully healed by now, but
Yeah.
you could get some residual pains. You can
Yeah.
still get to a full range of motion. That's good.
Okay.
Go as far as you can to the right. Nice. A little bit reduced on movement this side, but it's still within normal limits, so that's good. Lastly, I'll get you to stand up for me, please.
Okay.
Now, regarding that low back, I'll just get you to face out the window. It's okay that your head's cut off. Let me get you to bend down, touch your toes for me. I like that you're looking, though. You're considering. Yeah. Any discomfort of the low back as you do
No,
that?
that's fine.
Awesome. Come back up the other way. You can look at me here if you're not sure what I mean by that. You're going to extend back the other way. Does that provoke anything in the low back?
No, it's a little bit, not much.
Little? Yeah. Where are you feeling that
I
a little bit? Pretty central.
Yeah.
Okay, and higher up too in the lower back, like right in that region. So you can have a seat for me once again. She's pointing to that very classic TL junction area where the upper back, the thoracic spine, becomes the lower back, the lumbar spine. That's also near the ribs that you did have a break. Okay, the lower down on the right side. So that could be residual follow from that. Did you have the low back pain before the rib fractures?
Yeah, it's always been around.
You've had it for a long time.
Yeah, I just noticed that since the breaking of the ribs,
it's been worse.
It has been worse, you know, and so it's just something. It's just not comfortable, but it's not doesn't pain me. It's not comfortable.
Well, still, we want to try to make you comfortable, right?
Well, that'd be nice. I'd love that.
Yeah, well, let's see what we can do. So, how many years again have you been having this low back discomfort? If you had to put like an estimation on it.
I would say it's probably been, the last 5 years.
Last 5 or so years.
Yeah, and I really strongly feel it's directly related to lack of training.
Lack of training, okay. Because before that, I know we were talking a little bit off camera. You said that you used to be quite active.
Used to do personal training.
Okay.
Yeah, so I was really active.
And did you find that whenever you stopped doing that was 2018?
Yeah, 2018 I stopped doing that.
Which is about 6 years ago now. And then after that, then these pains started to creep back.
Yeah, not really right away, but as soon as your gains have gone away, I was leading a more sedimentary lifestyle, I would say, because I'm also an artist, so I was doing more art and crazy things on the floor.
There was also the pandemic that kind of hit, which made everybody sedentary. So
yeah, exactly. I forgot about that. How could I forget about COVID?
Oh, believe me, I haven't. Yeah. All right, so let's go ahead. Let's bring this leg straight up.
Okay.
Do we get any discomfort in the low back with this?
No.
You have really good mobility, by the way.
I feel it in my hands, but not in my back.
The average person can't hit 90 degrees, even though that is what you're supposed. That is normal.
Okay.
But the tension in the hamstring, that's normal with this.
Yeah.
I get you to slowly lower this leg down. Does that provoke any discomfort in the low back at all?
No.
No? Awesome. Let's go ahead and do that on this side. And you can get even further than 90 on this side and go ahead, lower it down. Any discomfort on that side?
No.
Love it.
Okay, good.
Right. I'm going to bend this knee.
Okay.
And I'll place my hands behind your hip here. I'm going to push my hand through this. Does that provoke anything?
Yeah, that provokes a little.
Where? Is that in the knee or where my hand is back?
Yeah, it's where your hand is.
Okay.
Yeah.
Good.
Yeah.
I'll take this. We're going to do the same thing.
Okay.
I'm going to push through. Is that okay?
Yeah, it's more where your hand is.
Yeah. Okay.
So that's not low back.
That's it kind of is. That's
is it? Okay.
Those are your SI joints. Okay, where the sacrum or the bottom of the spine connects into your ilium, your hip bones proper.
Okay. All right.
That is low back.
Okay.
Where you were pointing to beforehand is kind of the high end of low back, low end of upper back, TL junction, which we'll take a look at in a bit there. We're going to do a few more things for the low back proper. We're going to bend this. I'm going to open up the hip if that's at all possible.
Yeah,
is that okay?
Yeah, that's fine.
Okay.
I can.
You seemed hesitant, and does that?
Well, I wasn't sure where you were going to.
Oh no!
No, I actually love that stretch because then it just makes my legs feel better.
So do you get like a good stretch kind of in the adductors of the groin? Yeah. How does the glute and the hip feel with this?
This feels great.
Perfect.
Yeah.
Okay.
So I'm just going to the other one.
Same concept here. Yep.
Yeah.
That's okay?
Yeah.
Awesome.
Yeah. Less of a stretch in this one, but yeah, no pain.
Okay, good.
All right.
We're going to start lower down. Remember that Patty said she had most of her tension up between the thoracic and the lumbar spine, the TL junction specifically. We also had some aggravation of the SIs on thigh thrust testing, so we're going to go ahead and push through here. Is that okay there?
Yeah, a little bit of discomfort.
A little discomfort. Compare that to this side.
Oh, that's way worse.
Right side is way worse, okay? Yeah. So very much we have some SI aggravation down here, and we can absolutely treat that, no problem. Let's go ahead and work up the chain. So lumbar, once we get to about here, this is where you were telling me initially you have the most tenderness. Yeah,
yeah. Well,
probably worse on the right.
That's where, right where you're...
The history of the rib fractures, yes?
Okay. Right where you're at.
Okay.
Yeah.
Now, since then, have you had a subsequent or follow-up x-ray taken to evaluate the healing of this area, or no?
No.
No? Okay. You'd have to expect that after about 1.5 years, you would get healing of this, unless there was drastic displacement, which with ribs is quite rare, because when you get drastic displacement, you puncture a lung. Did you puncture a lung?
I did not.
Awesome. Happy to hear. Yes. So I would assume that after... that'd be 18 months of healing time. Yeah. We're solid there, but definitely going to have some residual pains.
Yeah. Oh.
Freebie. Yeah.
Funny.
Why, thank you. Some people think that I am. Okay.
Oh, yeah.
Ooh. Yeah, okay.
Yeah.
So this ties back into me mentioning how the shoulder, the upper back, and we haven't gotten to the neck yet, but the neck are all very connected. So we have that right shoulder issue, right? Feeling through the right thoracic spine up here, we got some tenderness, and like that's okay. I almost feel bad pressing into there, but we're just gonna try to stretch you. I do have a conscience, I swear. We're just gonna try to stretch you out first, and then we'll work in through adjusting that. Okay. So what I'm going to do, I'm going to kind of hook around your hip right here. I'm going to take my other hand, and I'm just going to do what we refer to as a mobilization or a stretch like that. Does that feel okay?
Yeah, I'm not sure if it hurts or feels good.
That's literally the motto of my clinic. I don't know if it hurts or if it feels good, but we're going to do it.
That's right. I like it.
Yeah. Wait until I get my tools out. You don't know what those are yet, but...
I don't know why I waited to come back so long. That's my problem.
Well,
it could have got fixed sooner.
We just met, but I guess I'll say I missed you too, maybe? Yeah, that doesn't really make sense, but that's what I say when my patients say, I don't know why I haven't come in months. It's like, you can just tell me you miss me. It's fine. But yes, it's, I mean, for whatever reason, people tend to really make their aches and pains and their whole musculoskeletal health not as big a priority as everything else. Like, for example, if you woke up one day and you had terrible, like visceral or gut pain, you'd probably go to the hospital, right? But if it hurts up here, whatever, right? No matter how bad it is. So it's just a weird kind of bias we put on these things. But all the same, I'm here. I'm waiting. If you ever need it, when you decide, you come on in. Yeah. Not going to turn you away. Ugh, you've been waiting too many years. No, not a thing.
Time's up.
All right, so let's adjust in through this area here. I'm going to move the microphone because that is the only reason people click Chiro videos. And we're just going to relax this arm here. Okay, you're good. Yeah. So to get this spot, what I'm going to do is I'm going to have one hand on your head. I'm going to rotate your head slightly. You just let me move it. And you take a big breath in. All the way out, fast, all the way out, good. There's a little one there.
Yeah.
That's quite tense. Breath in, please. All the way out. Wow.
What's that mean?
Wow means that you definitely have lots of years of tension built up.
Oh.
If I can't get through that easily.
Okay.
It's okay, though.
No, it's not in my head anyways.
No, it's not in your head. I can't confirm this. Yeah. One more try in. All the way out. There was a little one there, too, but definitely not going to be the easiest patient, that's for sure.
It's my MO.
Not the easiest person?
There's always something to figure out.
Oh, man. All right, let's do some trigger work then. Patty was saying she had some bad neck tension going on yesterday, especially. Was it worse on the right side with that shoulder?
It's always worse on the right side.
Always worse on the right. At least you're consistent, right?
Yeah. Oh, I'm consistent.
Yeah. Okay. So we're going to go ahead and feel through, especially lower down to start. Ooh, hello. Hi. Okay.
Yeah.
So a lot of muscle tension down low. A little bit of joint stuff, but it's more muscle than joint, that's for certain down there. Okay, I take that back.
Yeah.
Yeah, once you felt about 1,000 necks, you know exactly where to check. Drop the head for me, okay? Or just relax it, like as if you were trying to lay in a very painful pillow. There you go. What about as we get high? Do you have a history of headaches or?
No, not so
really?
much. Not really. I used to, not now. That's where it's right there.
Right at the top, okay.
Yeah.
So we've got some, not at the very top, but just south of that. So maybe C1, C2. And then definitely lower down as we get to the base of the neck. 2 sites of involvement for sure. I'd say that it's worse lower down than it is higher up. So let me just do a little bit more soft tissue work, and then we'll go ahead and adjust those, okay? Just think happy thoughts, you know, happy, relaxing thoughts. Drop the head. Good. A number of times I have to remind patients to breathe.
Yeah, I breathe. Just quietly.
All right, drop that head for me.
Okay.
I want you to just... Okay, I need 2 things for this to go. The first thing is I need you to relax your head in my hands, just like that. The second thing is to not know that I'm about to do it.
Oh, gosh, yeah.
You're good. Breathe. Good job. Now, did that hurt?
No, it didn't hurt.
It's just shocking.
It was shocking.
Yeah. I love that. Patients always go, ow! But it doesn't hurt. It's just surprising. It's like, what? Yeah. I'm guilty of that too. Even I do that.
I'm glad you did it that way. I don't mind the lead. I don't want to lead up.
Hey, no problem. I've done this a couple times, and I've learned that the best trick is exactly that. Unfortunately, it only works once.
There you go.
So let's try this higher area up there, even though that doesn't feel as bad as it did a second ago. We're still going to do that.
It still hurts bad.
Still hurts bad. Okay, well, let's see what we can do. So again, drop that head for me.
Okay.
Good. Okay, we're not going to go any harder than that today. All right, let's check out the other side, shall we?
Okay. So, you see, there's a pain. But it's all less painful.
Nowhere near as bad. Or a little bit, you tell me.
Yeah. No, it's not as bad as the right, for sure.
Good.
Oh, yeah, that would hurt. I'll get like a liar out of myself. That hurts too.
Patty, I'm enjoying your responses. I'm just going to come clean and say I'm enjoying this.
Okay, comedic relief.
Oh, yeah. Drop. So definitely not as bad as the right, but it's not exactly home free either.
No.
Okay, let's do it. Okay, drop that head into my hands. Good, just like that. Nice.
Okay.
Fantastic.
Mm-hmm.
Feel good?
Yeah, it feels really good.
Happy to hear. Recall, during our testing, Patty had a very tender right SI as compared to the left. The SI connects the sacrum or the bottom of the spine into the ilium or the hip bones over here. So let's get you a position. I'm going to pull this so you're off your shoulder. Good. You're going to hold right there. You're going to bring this top leg up, hook the foot behind the knee, and scooch the hips towards me, please.
Okay.
Thank you. Awesome. Okay. Now from this position, what I'm going to do is I'm going to ask you to breathe in and out again. Okay. And then as you're exhaling, you're going to roll your whole body towards me. Okay. I'm going to move you. I'm going to help you out.
Okay.
While really focusing on keeping the upper body relaxed.
Okay.
So I will walk you through this. I will walk you through.
Okay.
I made it sound more complicated than it is. Okay. So let's do this. I'm going to get you to take a big breath in. All the way out. Roll towards me. Relax the upper body. All the way out. Good job. See, that was simple,
It was.
right? And much easier execution
Absolutely.
than deliberation, I believe. Okay, so we're going to position you once again.
Okay.
I'm going to pull this, take this. Now, you're going to hold right there.
Okay.
This isn't going to be another SI adjustment like I just did on the right side. This is for her lumbars property. You guys, it looks the same to you. It might feel similar, but it's all with the intent of trying to open up that space on the right side still. So, let's go ahead, bring this leg up. Bottom leg straight for me once again, please.
Straight.
Hips are going to come towards me, come towards the edge. Good. Awesome. All right. So, lean your back just like that. Relax the upper body. Contacting those lumbars. Breath in. All the way out. All the way out. Good. Relax the upper body. There we go. Good job. Okay, so we had some trouble getting into the thoracic spine specifically with Patty. Lots of tension built up with her heavy labor job, as well as not really being as active or alternatively seeing people over the last few years. So what we're going to try to do here is address the fascial component that's definitely going on using the instrument-assisted soft tissue tools that we love on this channel. So we're going to do this for the full back with a focus of up here and on the traps too. Let's get into it now. Ooh, sensitive. If at any point in time it is a little bit too much,
Yeah.
you let me know and I'll back off, okay? Nasty in there. Ooh.
I think it's just the coldness.
Oh. Okay, a little warm up as we go. And do one more pass of the upper back on both sides, okay?
Okay.
You're tough, you're strong, you're tough, you're strong. So last thing we're going to do here today is MRT for the upper trap region and left scap. Very, very common on this channel. A little uncomfortable for you, but again, we're in here for the benefits, not the during, even though you said that you felt quite good after that. So I guess you look up and to the right for me to start. Okay, right. Good. Now, with you in that position, I'm going to take my pointy elbow. Yeah. I'm going to put it right there. And I'm going to get you to slowly look down and to the left. Go ahead. I'm going to look at the screen so I can see her face as she does this. She looks like she's tolerating it well. Good. Up and to the right. Down and to the left for me, please. Oh, there's a sound. Up to right. Down to left.
Oh yeah, I see it increasingly gets more painful.
Oh, yes, yes, yes. Up to right. Down to left. And up to right. Down to left. Good job. Okay, face forward. Tilt your right ear to your right shoulder. Good. Now we're going to tilt left to left. Go ahead. Okay, sorry, I should have specified slowly left to left. That's okay.
Okay.
Yeah, right to right. Now slowly left to left. Go ahead.
Oh, it's really hard to do that.
Yes, it is. And right to right. So I am literally left to left, pinning the muscle that you're stretching out. So don't expect it to be easy.
Yeah.
It's going to be difficult with me doing this. Okay.
Yeah, it's difficult.
Yeah. Right to right. Left to left. And right to right. Last one. Left to left. Good job. Awesome. Other side, we're going to get you to look up and to the left for me, please. Good.
Yeah.
And slowly down to the right. Go ahead.
Yeah.
Good. Up to left. Slowly down to right. Good. Up to left. Slowly down to right. You're okay. You're doing great.
Breathing through.
Up to left. Down to right. Good. Face forward. Tilt left ear to left shoulder. Slowly tilt right to right. Good. Left to left. Slowly right to right. Left to left. Slowly tilt right to right. You got it. And left to left. Right to right. Nice.
Whew.
Good job. You did it.
I did it.
Patty, how did you find all of that?
How should I answer that? I feel good. I don't know. Like I feel good.
Yeah.
And I've had some of it done before,
Mm.
but I have never had that scraping done before, which is quite intense, I have to say.
Of course. Yeah.
But I'm really looking forward to how I'm feeling tomorrow. That's really where my
Yeah.
brain is like, okay.
Yeah.
Because like you really got in there, so yeah,
I'm
like
happy
it
to
feels
hear.
good.
Yeah. So the scraping, the instrument-assisted soft tissue therapy that Patty's talking about here, fascia, not a lot of people address it for whatever reason, especially not a lot of chiros lately. Highly recommend if you have a chronic stiffness complaint, one that hasn't really responded to massage, to chiro itself, such as getting adjusted or physio, you see a fascial practitioner, fascial stretch therapy, cupping, instrument-assisted soft tissue therapy. One of those three should help the fascial component. We did have a mild to moderate amount of petechiae formation on you. I was a little hesitant about going too hard off the first one. When you come back,
Thank you.
we might do a little bit more, only because there's a camera on you. There'll be thousands of internet witnesses.
Yes.
Yeah, anyways. Do you have any questions for me kind of at this point?
No,
or?
I think I'm good. You're pretty thorough.
Oh, thank you. I try to be. I appreciate that a lot.
I appreciate it
So,
too.
yeah, thank you for coming in, Patty, and
very
I will
much.
see you again
Great.
soon, I hope.
Absolutely. Don't forget to like, comment, and subscribe.
Thank you, Patty.